Dissolving tear trough filler, and why you often don't get the results that you're expecting. This is a very common procedure in aesthetics these days, using injectable hyaluronidase, an enzyme that dissolves hyaluronic acid, the thing that most fillers are made of. And often people report, when it's injected under here for unsatisfactory results that they want removing, that they're left more dissatisfied by the results after the dissolving. Why might that be? Well, there's a number of reasons, and I'll try to whiz through them. The first one, the most obvious one, is the hyaluronidase being injected into the right place. Because filler can be put deep, it can be put superficial, and if you're injecting in the wrong place, you're not even touching the filler, there's going to be no evidence of action. Number two, is it just that it's been so long since you had the filler put in the first place that the original problem for which you had the filler, you've forgotten what it looked like? And actually, when you remove the filler, change the filler, that original problem shows itself again. But of course, you've aged since then, so it's got worse. I also have a theory that there's perhaps some underlying tissue degradation from the fact that the filler has been in there over a period of time. So you are resorting to a worse baseline. But memory is a hard thing to measure what it was like before unless you actually have that photograph, and you can apply aging changes since then, loss of volume and other things. So there's another one, but here's the big thing. Just as I was preparing this reel, I saw a paper that's just been published by Dr. Stephen Harris in the Aesthetic Surgery Journal. It's an editorial narrative, actually. Great piece of work, as usual. And in it, Dr. Harris suggests that we stop calling it filler dissolving and we call it filler modifying. Modification, I think, is a great idea. Because you use the word dissolve, people think it will go away. And as Dr. Harris points out in this paper, actually it doesn't. It modifies what has become over years a very complex matrix where the filler was originally put in. Another filler may have been put in afterwards. There's partially degraded filler, there's some chronic swelling from it, there's some fibrosis, there's a whole number of different things going on. And by putting hyaluronidase in, we're changing what was filler and is now this thing into something else, less obvious, less voluminous. And so you see changes. Some people report improvement, but you don't necessarily get rid of the problem, and some of the issues continue. So I think it's a great paper. I think it's a brilliant idea. I do believe that we should all start calling it filler modification, not filler dissolving, because it immediately sets the right tone in patients' heads. But if you're somebody who's thinking about having it done, just bear in mind, you're modifying, you're not dissolving. Remember that, because it changes your expectations. And I think that's a more accurate and honest way of describing it.